everyone. Thank you so much for joining us at the Parent Confidence Lab. We are really excited today to have an incredible pediatrician joining us. And we have Dr. Stephen Abelitz here today. And he is a board certified pediatrician. He's also a healthcare entrepreneur, a physician executive, and an advocate for nearly 30 years of clinical, operational, and leadership experience across the healthcare industry. He's also the founder, owner, and operator of multiple pediatric practices, including Ocean Pediatrics, which we'll talk about today, and has extensive experience in practice development, acquisitions, physician leadership, business growth, and healthcare innovation throughout California and the United States. He's also, been seen as one of the best pediatricians in the United States, which is very exciting. And he is very committed to advancing children's health, safety, and well-being while serving as a trusted advocate for patients, families, physicians, and independent medical practices. So thank you so much, Doctor, for joining us. We're so excited to have you today. And I would love to just start off to hear a little bit more about your story. How did you get started starting your own practices and building out your own clinical space?
Thank you, Christina, for the warm introduction. And thank you for having me on the podcast. And really appreciate that. And I always enjoy being able to interact with the parents and help them in their journey on parenthood. And specific to what you had mentioned, being a trusted resource of information. In today's world, there is so much information that we're all exposed to, and the accessibility is tremendous of what we can, and finding the right trusted resource is the challenge. There's a lot of good information out there, but there's a lot of misinformation as well. So I started my journey in pediatrics. I completed my residency here at locally in Southern California at UCI a long, long time ago, and 30 years ago, and jumped right into the fire, or into the pool, however you want to put it. Wouldn't call it a fire, but into the deep end, and went into private independent practice at the time, in here in Newport Beach in Southern California, and found that was the right calling for me. And over the years, expanded into the Orange County region from Newport Beach. We expanded into South County, Laguna Niguel, and then into Ladera Ranch. And always my happy place was with parents and children in the exam room, but also felt we could be impactful on other arenas. So expanded our reach. It was always a tough balancing act. How do we stay engaged with patients? How do we stay true to the core of really being a pediatrician, but also expanding to enable to extend our reach? We're one person. So how did we manage that? Had its challenges, but I think we did the best we could, and the result was good. And over the years, as you mentioned, expanded our reach into all of Orange County, then even Southern California, and then even had an impact nationwide from both the clinical director, medical directorship as well, and other platforms that we're involved with. I'm on the board of managers of Children's LA, work very close with them as well, and multiple other arenas. But the last couple of years, have kind of come back more into what I call the happy trenches, and doing a lot of all the other things we do, but getting back into grassroots, because we found that's where we're really happy. That's what we like to do, and spend a significant portion of our time focusing on that, still engaging in the other arenas.
That's amazing. It seems like you're doing, I don't know how you have more hours than 24 in a day, but it seems like you must have about 40 or 50 hours in a day. Seems like you have a lot of things that you're doing. And I really love the fact that you're very passionate about, parents, about the children, about that personalized care. And I've talked to hundreds of pediatricians, and I know that everyone is, managing a very full schedule. But how do you find the time to actually make that personalized, touch and personalized care with each and every patient that walks in your door, while still kind of managing the day-to-day of the business and making sure that, things are moving forward?
Great question, Hans. Look, I wish there was more than 24 hours in the day. And of course, I'm a family man. I'm a husband with 3 children and involved. I never wanted to have them feel that they're not getting the attention from me and the assistance that they need. So there's that balancing. That's a top priority for me. But the way I do it is I figure my schedule, and I, schedule patients 4 days a week. And I make sure my schedule is done appropriately. So that way I'm not overburdening the schedule, and not overschedule. So that's my priority from that perspective. And I make sure when I'm in the exam room, before I'm going to be seeing my patients, even the day before prepping my charts, even at the end of the day, and we can go into the burden that we have today with so much documentation and so much bureaucracy and all of that. So that I keep as my core focus of my week schedule. And then I find the time on the lunch break early in the morning, my age now, wake up earlier. So, if I go and round on babies in the hospital, before we start in the clinic. So, if I start rounding at 7:30 or 8, I get up at 5. I do a lot of my other things earlier. And then when I come home at the end of the day, of course, I also have to take care of my physical and mental health. So I make sure I exercise and do the things I need to do as well. And I don't compromise on that, because if I'm not healthy and not here, then I can't be as engaged as I want to. So at the end of the day, I will, focus on, once I'm done with all my other things, I get to my emails. I text, I will answer right away. I really only get to my emails at probably closer to 10 o'clock at night. I'm in a place too, my children are all bigger. I have a 25-year-old in medical school, I have a 22-year-old in the business world, and I have an almost 18-year-old going to be a senior. So they don't need my actual time as much as they used to. It was more challenging when they were younger. So it's not immediate time as they need me as much. So that I do it. One of my OBGYN colleagues that I admire a lot, she told me, Dr. Howell, she's a spectacular OBGYN. She said, how do you get something done? If you want something to be done, you give it to a busy person. And I went through a couple of years when, we went through the stint of the private equity stint, and that was a less exciting chapter of my life. But I found I wasn't as busy because of things that evolved there. I actually got things less done. And, being really busy, I find I get things done more, the challenge is finding time to watch a little more soccer. It's the World Cup soccer. I'm an avid sports fan. So that gets a little challenging, as we're talking, there's the Ghana, England match right now, because I'm a big England fan, So those things get to be a little compromised, but I find time for that too. So I think being really busy helps me actually accomplish more and being engaged more. And so I think that's how it works. This new chapter of ours, the last few years, I don't think, and I don't want to jinx it, I've been complained once that never spent enough time, haven't responded, because in my last chapter, there was a little bit of that, and I think it could have been maybe because my kids were smaller. Also, maybe I didn't know to manage my time as well. So it's working out that way. I wish there was more hours in the day, but I'm very content with what I have on my schedule.
That's amazing.
Wonderful. Doing the math, that's about 6 or 7 hours of sleep. Is that enough for you?
Another 6 hours, probably more. It's enough for me. That's all I really can do right now. Even when I'm on vacation, more than 7 doesn't work for me anymore. I used to love sleeping longer. So I think it's to the advantage of doing more things and be more active. I always like to find to make the lemonade out of the lemons. And I think being now in my stage of my career in life is, the fact that you can't really sleep more than 6 hours or 6.5 hours helps me be productive in the other arenas. So make lemonades out of that too,
Well, doctor, that really resonates with me, because if you ask Christina, I am a late night owl and an early bird, both at the same time, because I'm like you, I'm getting my emails done during that golden hour between like 10 and 12 o'clock at night. And then I like to surf. And so that's my way that I keep my zen and keep my, keep my head on straight too. So
I love it. That's so aligned with how my schedule works.
That's wonderful. And I know another thing we're very aligned on is kind of working with parents to feel more confident, more calm, more collected with their children. So how do you support parents in that space?
So I think, first of all, it comes naturally, being a pediatrician, or pediatricians are most like that too. It comes naturally to have empathy and understanding. So that's kind of, driven naturally. So I don't have to make too much effort of that. I think experience has also helped me over the years, because, you come out of residency and you're in this academic arena, and you're in this kind of box, and the way you educate and come out, it does at time become a little rigid and a little regimental. Over the years, it's not that box that you were taught. It's great. It's given you the foundation. And you got to come from an understanding there's a spectrum of parents and moms, of what their beliefs are, of what they think about, and so many different realms of parenting. The hardest topic today is vaccines, for instance, and we're happy to, dwell on that a little. So coming from a place of understanding of where the parent is coming from what I shared medical decision making, I tell parents that we're a team. We're working together. It's not the physician and what we say, and it has to be, that team effort and working together and working collaboratively, I believe works for a great relationship, a great dynamic, and ultimately better outcomes in what parents trust and believe in what they need to do to make the right decisions for their children.
On that note, parents a lot of times, and I'm one of those, I like to come into a pediatrician with maybe a laundry list of different notes or different questions that I want to ask. But, sometimes that could be almost too much or sometimes not enough, right? There can be a stigma in terms of how parents relay a lot of information to a pediatrician like yourself. What is the right amount of digging in that a parent should do, whether, it's Googling at home or trying to bring some observational insights from, knowing that they know their child best, into that clinic room, knowing that, they don't know everything, but maybe it's something that might be helpful to getting down to a particular challenge. Like what's the best way that a provider and a parent can actually collaborate?
So I think the most important thing when leaving that visit is not to feel like, oh my goodness, I had so many more questions, so many more things I wanted to ask, and then left feeling kind of empty and having to call back. And we sometimes do a parental call back and say, hey, I forgot to ask you that. We'll always call back our parents. We always tell them we guarantee calling them back that day. Maybe later at the end of the day, because we're seeing patients and doing all the other things. So it may be closer to 5:30 or 6 o'clock, because when I'm done with my second shift of the day, I prioritize the callbacks. From a preparation standpoint for the parent, I always tell parents, use your notes, however you want to do it. Your iPhone and notes are great. Write the questions you have that you were thinking about, put them in a bullet point format, and go through those questions. And we'll go through all those questions and concerns so that you're prepped with that. So that way, what's important to you to ask. And before we even come in, our medical assistants who room the patient, they're asked them as well. What are your concerns? What are your questions? So even they will have a few with the parents are the main questions the parents have. And when we go in, that's kind of probably one of the first things we'll address. What was brought there is the chief, concerns or complaints that, from a medical standpoint, that parents have. And then we'll go through what we call kind of the problem list, and we know the patients we'll go through. And then we'll always open up. Is like, did you have any other questions? Did you have any other concerns? And then we'll kind of address the primary reason for being in the exam and all the other things. So that's kind of the workflow that works for us. It's kind of evolved years, and I think that works well.
And what are you kind of seeing in your kind of patient population and families? What are the main issues that people are worried about now that you're kind of talking them through, that the challenges that they're facing?
Look, we see a lot of new babies and new parents, so we can focus on that as well as but across the ages. I think the biggest concern and questions that we're being addressed with are vaccines, and for instance, newborn babies, should we do the vitamin K, the erythromycin, the hepatitis B? And some coming in with questions, some coming in like, we don't want to do this, and this is what we want to do. So the exposure to all the information out there, and there's a lot of fear being driven and placed into parents' minds. So I think the fear and misinformation of so many different things, and specifically with new parents, vaccines and what to do, before it was standard. Come in, you have your baby, get the vitamin K, get the erythromycin, get the hepatitis B, no questions asked, done. Now there's a lot of those. So especially because we're seeing so many new babies and new patients, that's a lot of what we deal with.
Yeah.
And then across, then it really becomes specific towards the different ages, toddler ages and going to school and what schools to do and behavior. And then getting into the school. Once you're into the school, is how the children are adjusting to school, questions related to school. As the kids are getting a little bit older and they're getting into preteens and teens, anxiety, depression, behavior health has become a big issue and concern. ADHD and attention and stress. Then, as we're getting into the 16, 17, 18-year-old, stress of college. What are the children? What's the future for the children? Should they go to college? Which colleges? And then even we take care of, younger college kids and dealing with the challenges in college. So age specific, I would say if I nail it to the biggest, concern today is vaccines and what to do with babies when they're in the hospital.
Yeah, we hear a lot about that with the mental health issues, certainly on the teenager and really tween age side as well, whether it's, due to anxiety, depression, but also sometimes can be screen time and social media, which certainly has a role to play there from a mental health standpoint. So we saw that, Australia and I think the UK have now started to do away with social media for under 16. What's your take on that, the appropriate amount of screen time? We know that, a lot of times it's a digital babysitter sometimes if you're trying to have a nice dinner, but it's the easy thing, but a lot of times it could have adverse effects. So what do you tell your parents about screen?
From a pure scientific standpoint, there's no clear, there's different declarations of certain hours and taking away social media under the age of 16 and under the age of, 2, not having any electronics available. In general, I like to be in the middle. I like to find a middle space. I like not to get over dogmatic on one side and I like not to be too flexible. And again, it's different parents and different families. I believe, and you mentioned meal times. I believe, even though it can be, like you said, digital, look, an 18-month-old, we could talk about that, or a 2-year-old, a digital babysitter, but, a 5-year-old, a 6-year-old, an 8-year-old, 10-year-old, I think any electronics or social media in place of, family mealtime, in place of activities, in place of schoolwork should only come secondary. The amount of really time on social media should be monitored by parents in, the different forms and ways technically you can monitor as well. Of course, parents are very aware and parents should be aware. I think any minor should have some sort of monitoring on social media, because safety primarily, especially as they get older. So there should be some sort of monitoring. And again, different ways you can monitor, how strict in the guidelines, like you said, from the UK and Australia. Still hasn't, because things are evolving so much. And I don't believe a pure cookie cutter guideline. I think monitoring should be in place. Limitations should be in place. Never should be social media, electronic usage should never be instead of family time, meal time, sport time, school time, those kind of the priorities. It's a secondary, should be limited, and definitely there is an overusage. Look, I think all of us on here, parents listening, we all use the phone too much, including myself. You talk about time, and with my time, for instance, even with the time we spoke about, I think I've seen certain things I'm probably on at least a couple of hours a day. With all the time, hour a day, it's natural. We see it, we look at it, it's got the dopamine release. So I think we also got to be careful with our children, especially our teenagers, not to be hypocritical and not to say, hey, nothing, go, no social media, no time for a, almost 16-year-old. When we're doing it, we've got to be really cognizant, because you lose trust and credibility with your teenager. Same as a pediatrician can lose trust and credibility with a pediatrician. So it's complex. There's no right number yet. I don't know if there ever will be. So I think we have to be open-minded about that.
So true. And I know you were mentioning kind of as your patients are aging, that there's more concern about, childhood anxiety and depression. And how do you kind of work with the families when they're starting to notice these kind of behaviors in their children? And what kind of advice do you give to parents who might be struggling with some of these issues?
So this, for a pediatrician, and that's why for me, it's so important to have a medical home, to have consistency in the practice. in today's world with hospital system groups and with private equity, the turnover is tremendous. There's no consistency. There's no building up a relationship. So I'm seeing now the kids of the kids, the new moms that having babies now were my patients too. So we have built-in credibility and trust. So, pediatricians, we see the, families a lot. We, at that age that we're talking about, we see them at least once a year for the annual checkups. We make sure if they're missing, we remind them. And now, I'm going to say there's probably a 95, 98, 99% compliancy with that. So for instance, for example, the well visits, before they're even coming into the office, we have them fill in what we call surveys. They're different evidence-based surveys. There's the general anxiety depression survey that scores. There's the PHQs for depression. There's a PSC. So we have them fill in all of those. Teenagers fill that in when they're younger, sometimes parents, but mostly the teenagers. So we're already highlighted, a lot. The alarm is set off if there are things that were given before we even walk in the exam room. We review that during our well visit or our physical once a year. And we go, and it's amazing how much we'll pick up. We're also in our questions, what we'll go through. We'll start through how's school, how's it going, what grade are you in, how are your grades, what are you doing for your other activities, what are your interests, what are you doing with sports. So those are other ways for us to pick it up.
Mm.
Now, as a pediatrician doing this for 30 years, there's another tool we have. We walk into the exam room, we see the pediatrician, we see the family, we can pick up a tremendous amount. I always say we're like the butcher who can tell the different pieces of meat of the we walk in, we can tell a tremendous amount. That's why I think AI is going to be tough to completely replace us, because we walk in. So there's so many tools that we have. And then, as we mentioned before, whereas any questions, any concerns. And then, for instance, a teenager, a 15 or 16 or 17-year-old, we have the parents leave. And my style and mine is to the teenager and say, look, we always encourage for you to be open with your parents, share with them, but we're a resource as well. We keep things confidential. It's against the law for us to run and tell your parents things you're telling us, unless you're in danger, you're hurting yourself. So that way we open that communication, So there'll be times, give you an example. So a teenager yesterday didn't pick up on much of that, a little bit here and there. Didn't, when I went back in and reviewed those surveys, I'm like, whoa, there's a lot more here than I have to be. Called back, spoke to and addressed it there. And so there's many ways that we can identify. Of course, it's not 100%, but it's a very important part of a pediatrician's jobs to try identify. And then the bigger challenge is quarterback what to do, because then we can get into our broken healthcare system in our country, especially with mental health and accessibility, where, if you want to try get under your insurance and see a mental health, behavioral health profession, good luck to you in most areas. And then even seeing some of those that are out of pocket, and then the cost can be exorbitant. So we quarterback and try figure out the right direction for parents, but that's a challenge, and that goes into how broken our healthcare system, especially because payers, their goal, insurance companies, to make money, and they're doing a tremendous job of making billions to trillions of dollars on the backs of patients and physicians. And mental health is a blockage. They do not cover much. So we're working on ways to get them accountable and involved to help us help parents with behavior and mental health.
Yeah. But you mentioned the broken healthcare system, and we can probably talk days for a lot of the things that we wish were better. But if you were to pinpoint, one or two things that you would say, this is something that I wish I could change overnight, whether it's the way we treat mental health, or other issues that could be small things that make a really big difference for a big population. What in the healthcare system would you?
And it comes to me as easy, because the biggest thing that our system is, the reason for the system is broken, and the biggest fix is that the care of patients was taken out of the hand of the physicians. It's put into the hand of executives, the C-suites, the CEOs and the CMOs, and the physician puppets that are now, singing to the tune of these executives because of the incentives that they're given. And the driving force and the decision-making today are made by the C-suites, the executives, especially the CEOs of of the hospital systems, of the private equity, of the insurance companies. I think the biggest thing needs to be awareness. And then it needs to be an awareness, meaning, many people don't realize until they really need it or they have a problem. And then oh my God, the system is broken. This shouldn't be that. And then the media is super quiet on this. The media, I wish they would spend as much time on this situation as they spend on so many other subjects. And then our politician. These hospital systems have so much money and these private equity, and they have all the lobbyists and the money going into there, back in, 2010, 2012, I mean, you had a problem with preventative care and how to get it covered for an Affordable Care Act for all positive and negative. There was a lot of awareness. There was a lot of politicians. There were a lot of reporters and got the Affordable Care Act. It had some really good things, but what it did is, for many complex ways that it put billions to trillions of dollars into the system from the government, from the taxpayer, and it's been shifted into the hand of executives, insurance companies, health, hospital systems, and private equity. And the physicians have become disempowered, and they're really not the driver of the healthcare of the patients today. So I think that's by far the biggest challenge. And if that pendulum could swing and change, I think, because we're not perfect as physicians, but we're trained. We went into this profession, the majority of us, for patients first. I always tell our patients and new patients coming to us, for us, it's patients before profits. We need to run a business. We need to pay the rent. And it's challenging today. It's more challenging than ever, and it's getting more challenging. But we're patients first. For the C-suite executives, it's, of course, profits and ego before patients.
Yeah.
Go ahead, Hans.
Yeah, no, I mean, that's a lot. And it's certainly, unfortunately, probably not going to change anytime soon. We talk about value-based care, or we talk about preventative care overall. But then you also have AI, and certainly, we haven't even touched on it in this conversation, but AI plays a really large role in whether it's clinical workflows or billing or, radiology. But in your practice, whether it's parents coming in saying, "Hey, I saw this on ChatGPT," or another of their favorite LLMs, where do you see AI playing a role in your practice, for the better and also for the worse? I mean, I'm sure there's two different routes that AI can actually go in.
So I'm an optimist. Maybe that's why I went into pediatrics. I could have done a bunch of other specialties. I think it's more for the benefit than the detriment. I think, first of all, personally, I have some books behind there. I don't know when the last time I opened them, because I use AI, but I use what's called open evidence. It's a clinical medical-based AI, and it's evidence-based. I use it all the time. It's tremendous. A lot of AI is what question you feed AI and how you feed it. I find, for the most part, from our parents, Chat, Claude, some of the others are they're not perfect, and you're always going to be a lot more reliable than before, when you were kind of Google and you would Safari and you would Chrome, because then you never know what else is being paid ad. I'm not seeing paid ads coming in, a lot of bias shifting in. So I actually see an advantage coming in from parents. They're actually coming in more prepared. Less, I'm going to say, questions regarding those kind of items, because we get less calls in the middle of the night, because it's more reliable. So I think there's an advantage for the clinician if used appropriate. There's advantage for parents compared to what they had before with AI. So those I'm going to look at as big advantages. And for us, we haven't found the right platforms to help us save time. There are those that are utilizing for documentation and visits and all. We haven't found the right platform to integrate that completely. So that's still, I think, when that comes in, that's going to help save us time and hopefully free us time, hopefully. Those are the positives. The negatives, the way I see it from a patient standpoint, from us a little bit too, but I think we're more experienced, so it's less. It's not as easy for us to be fooled, for parents to not to fully rely on it, to always rely back on the physician or clinician that they trust. So not fully to rely on, because that can be dangerous at times. The biggest challenge we're seeing currently with AI, insurance company using AI to deny and not pay us. And it's off the charts. It's something like I've never seen before. And that's actually where we're had some financial troubles. We had to pump in from my own finances and savings in to keep and we're in a practice that has good insurances, and we're in, an area where patients have, they can afford things. We're in some trouble financially because the insurance companies were denying us for the most mundane, not even for a reason, just denying. We had contracted rates. They were paying. They used AI to play it so they could pay us a third of what we should be getting. So January and February, we were in trouble, financially, because we were just not getting paid. We were underwater, and and so we had to get a new biller, and we had to look at different angles, and we had to try, utilize things. And fortunately, I have the good folks in the different, I won't mention the specific pairs. There were a couple that are specific that helped us hold them accountable. But, fortunately, we had the bandwidth to deal with it. They rely on so many not having the bandwidth. So using AI in this is a challenge. And then the biggest, question out there is AI going to take over from radiologists, going to take over from pathologists, going to take over from maybe physicians. As I told you, it's going to be hard for AI to walk into a room and pick up a lot of things we do. So there could be that future challenge of what, could it replace us? That fear that's out there.
Yeah.
That's a big fear for a lot of people in many different professions. So I can quite imagine.
Yeah.
And I mean, kind of pivoting a little bit back to kind of the patient experience, and as both a father and a doctor and a pediatrician, kind of looking back on your own life, when you were first starting out as a father, kind of what do you think you wish you had known then that maybe you're imparting on your patients now when they have that first child?
I always look retrospectively, and I look, you can be perfect. I made many mistakes. I can happy to share, but the end results and how we got through. And, I had Father's Day the other day, and the gratitude that my children, the things they mentioned, showed that, hey, we did a great job. And even though we made mistakes, so if I would, so I look at the positives first. I think looking back, I made mistakes. I think the biggest thing is to learn from your mistakes, to evolve and try better yourself. I'm going to categorize myself as a first-time anxious parent. And fortunately, my wife is a little more chill about things and kind of balanced, out there. So I think maybe instilling a little more, if I was a little more, had I been, more patient and calmer, those would have been, I wish I was maybe a little bit more of that. And when my children went through, the hits we get when they're teenagers and some of the things they're experimented with and my reactions, give you an example. Went through my first two children, and I felt that I wish I had a better relationship with during the teenage years. We have an amazing relationship today. It's evolved. So I must have done something right there. So with my third one, when I saw some of this kind of history repeating itself, one of my moms in my practice is a parent coach for teenagers. And I engaged her services. And it was amazing. The things I learned from her, and how to respond and how to react. And the tools were priceless. And it helped me today, and even helped me with other things. So I think engaging the right people, even if you're supposed to know and do, I think maybe, like you say, engaging earlier with folks to help coach me as a parent, because I was a new parent. So I think the message to parents on this podcast is, engaging the right resources with the folks you can trust and you see good results with and who are credible. Because again, there's a lot of misinformation, there's a lot of misleading, and there's a lot of ulterior motives. So I think the biggest if I would summarize what talking with you, because I never thought back, is maybe engaging more like I did with my teenager earlier, folks to help coach me and direct me through as a parent at the time.
Yeah. It seems that you're a very big advocate on learning. It seems like you're always constantly learning, improving, the books behind you and engaging different services. But, parenthood in general is a big learning curve, right? No stages are the same, and no parent before you become one really knows what to expect. And so when you think about nurturing a child from the very start, from that very first moment you hold your son or your daughter, um, what would you say about building the right foundation, the right fundamental environment for a healthy development for a child, for that parent-child bond overall? Especially in those formative years, those early years of life.
Yeah, and I think we all just brings back memories of our first child when we had that moment. We're like, oh my God, we're a parent. This is amazing. This is unbelievable, but scary too. So I think, of course, and we all, almost all of us have it naturally. Love, showing your love and sharing your love. I believe there's a lot of chemicals we release when we share that, and children feel that, and they feel the love, and they feel the trust, and they feel the connection comes naturally. I think that's there, and to nurture and enhance that feeling, I think, is invaluable. I also believe the environment we create. We're going to have rough times. There's going to be tough moments. Trying to instill an environment for your child more positive, building confidence, building trust, building credibility, that your child has that trust and credibility. We all get shaken up a little in the teenage years because part of developing is to actually go through them, believing their parents not to actually trust you as much, and not, but especially in that early years, I think that environment that you instill is critical, that it needs to be a lot more positive than negative and stressful is extremely important for that journey of parenthood, but for childhood. I know one of my youngest wrote up is in her thank you card was, "Thank you for giving me an amazing childhood." That was like, wow. That was 2 days ago. Even thinking about it, get a little emotional because that's amazing. When you get those kind of feedbacks, that's amazing.
Wow. Well done. Congrats. Because that's
Well,
really,
there's some good moments. There's some, we all know that is, we could share you some of the tougher moments, but that's priceless. That's the ultimate, in what you do and what we do, and I think, in the end, most of us are fortunate that our kids, come around. And then also, look, we don't have full control exactly how they're going to evolve to. It's a little bit of, what you do too. It's not a lot. It's a lot of what you do too, but it's a little bit of luck too. Fortunately, I was blessed to have children that turning out the way I'm blessed to feel that they are. And sometimes we can just, luck is not on our side the way it turns out.
Christina and I are very grateful for our children, but we also know that there are very difficult times. We had a really big temper tantrum last night, but it was, it's one of those things where as parents, we have to have that patience, that grace, knowing that that's a tough moment and just getting curious and not furious. Right. And so, I'd say giving them time, the more time, we spend with them, the better off behaved they are in a lot of different ways. And so there's definitely a reflection of that. So.
And it's also very important how we respond in those rough times. The temper tantrums is it's a rough time, and how emotional we get. And sometimes we say the wrong thing or do the wrong things. Sometimes I say folks still believe in timeout or a little modified timeout. The timeout's often for the parent, so they can calm down and they can rethink it. Because a lot of time, we look back and say we could have reacted differently. So I think first and foremost, trying to be insightful and trying to stay calm, observe the situation. Even the toddler, giving that toddler that opportunity to express and see. And I use, for instance, a toddler, your biggest tool that you have with that, once you've done all of that and you've calmed down, you've absorbed the situation, even validate their feelings. I'm talking a little bit from my coach, from the teenager, those kind of terminologies, but then distraction. Toddler, one of the biggest tools I believe we have is distracting them into this. They're easy to distract. You can't distract a 16-year-old or a 15-year-old. Can't distract an adult when there's a rough situation. Toddlers, you can still distract, trying to, be dogmatic and say, you shouldn't do that. No, don't do that. It's wrong. That's probably not the most efficient tool you'll have.
Yeah. No.
That's interesting. I was funny because so this was our 8-year-old now. She's 8. And I realized with all of our kids, when they start to get a little bit, their moments of temper or meltdowns, the one thing that does distract and always work, which is very cute, is their 1.5-year-old sister. Like when she comes up and tries to comfort them, or, my daughter eventually, she's like, I want my alone time. But then the baby crawled out with her and she was like, yay. And it just put her in a better mood. And it just said, what you were saying about love, like giving and receiving love, and then the benefits it has to us, is so important. And for us being aware, she was at a 7-hour surf camp in the sun all day, probably not eating or drinking enough, like exhaustion, dehydration, these things play into to how we react and how our kids react. But I think what you said, taking that time for yourself, is really important. And I think one of the parent coaches said, like, try to be the calmest person in the room. And I'm always thinking that, just reminding myself, like, be the calmest person in the room. Doesn't come naturally to me, but try in those moments.
So I'm going to take your advice, doctor, in this. So the next time I see Christina getting emotional from a temper tantrum, like, I'm going to put her in timeout, say, you got to get the timeout and find a laundry room so you can chill out. Because we, like, in all seriousness, we actually have like a code word where we just say, all right, you need to step away and I'll come in. Like, whoever is more calm in the moment, should be the one handling the situation, which oftentimes we just tag team out.
That as a team too, with whoever your partner is, whoever you're the support you have, utilizing, being consistent in the team that you have. I think all of those are extremely helpful. And again, always realize I'm not going to do it perfect. There were things, maybe you did yesterday and things I do. And even in our work environment, I'm going to say now, because I don't have younger kids as much and I don't have to deal with it, but it's work. I quite often have, work on reminding myself. It's my staff, be patient, understand, have a positive environment. Collegial is so much important. If we have a good positive environment, our patients and parents are going to have a positive environment. So I think it works in life too for all of us, but especially children, as you mentioned earlier, what will give the best results for them turning out as best as we can hope for is all of those things.
Yes. And then trusting us enough to share what they're really feeling.
Yes.
Is really important. I think
trust and credibility. I always go back to that,
Yes. Well, thank you so much. It's been so wonderful to have you with us today. We've all learned so much. Are there any kind of final last words or piece of advice that you'd give to all the parents out there listening?
So I think the biggest, we spoke a little bit, trusting yourself. Always try and learn. The most important, I would say, is rely on the right support, the right resources. Find a pediatrician and clinic that you can trust. That's it. That is there for the better and the best for your child, and have them build trust and credibility. Because it's frightening out there. What do I see sometimes, not from a pediatrician standpoint, from other resources coming in and trying to influence decision making. Those things frighten me. So find, the right resources of trust. Find a medical home. I'm a strong believer that all of us, even us and our children, you need a medical home. That usually is the independent private practice, because that's the true medical home. And try find a place where the physician determines the well-being and health and decision-making for your child, and not a chief executive officer of a big corporation or hospital system or insurance company.
Makes a lot of sense.
Awesome. Well, thank you so much, Dr. Abelitz. It's been an absolute honor and pleasure, and we've definitely learned a lot. We'll keep on learning, but thank you for your time today.
Thank you for allowing me to express myself. And I feel that at least to some folks, it'll be very beneficial, and appreciate what you're all doing to help parents in their journey of parenthood. Thank you.
All right. Thanks so much.
Bye-bye.